Perfect, thank you. Let us begin. So today's topic, we are talking about vertigo, dizziness, and balance disorders. So what is vertigo? Give me 1 second. I want to get this taskbar away. Perfect. Okay, so what is vertigo? Vertigo, actually, it's an umbrella term. When somebody says, oh, I have vertigo, or they go and they see their primary care physician and they say, oh, well, you have vertigo. That's actually a layman's term, vertigo. It's almost like saying, my family's from Europe. Well, where in Europe is your family from? Are they from England? Are they from Scotland? There's so many different countries in Europe. Same thing with vertigo. There's so many different types of vertigo. It's really an umbrella term, so it's not really an accurate term. So today we're going to learn about the different types of vertigo and what type you might have, or maybe a family member of yours might experience. So I'm going to give you some more information about that. So with vestibular disorders, when I talk about vestibular disorders, I'm talking about balance, dizziness, those type of disorders that we have. So there's two different types. There's peripheral and then there's central. So peripheral is more in the inner ear. So I don't know if you can see my mouse, but this on the left here, this picture, this is the inner ear. And in our previous Zoom session, we did a lot of the anatomy of the inner ear. So I'm not going to go so much into that. But this section right here, this is the balance system in the inner ear. So with the balance system, there's a lot of different organs and parts, but we'll go into detail with those parts for the different disorders we will speak about in upcoming slides. Also, there are central vestibular disorders. So central is more dealing with the brain. So we will go over different disorders for both peripheral and central today. So peripheral vestibular disorders, what I'm talking about, it's more damage or dysfunction of the inner ear structures, including the semicircular canals and the otolithic organs or the vestibular nerve. So I'm going to go back on the slide here. So these three canals, those are your semicircular canals. Below the semicircular canals, we have our otolithic organs. And then we also have the hearing nerve and the balance nerve that leads up to the brain. Okay, so here again is a picture of the anatomy of the ear. We have our outer ear here, we have our ear canal, we have our eardrum, then we have our middle ear space with the three bones, and after the middle ear space, we begin to see the inner ear, and that is where our balance system is located. We can see our three canals here, and we can see the hearing and balance nerve as well. So this is just another picture of the organ of the inner ear for the balance system. I'm not going to get too much into detail right now, but just so you can see that again. So there are a lot of vestibular disorders that we will talk about today. A lot, again, that I might not mention, but are also on the list here, but these are the main ones. So I will go into detail for each disorder. When somebody says they have vertigo, most often times they're talking about number one here. This is benign proximal positional vertigo, BPPV. There's also Meniere's disease, vestibular neuritis, vestibular schwannoma, superior semicircular canal dehiscence, and vestibular paroxysmia. Cholesteatoma, labyrinthine fistula, enlarged vestibular aqueduct, labyrinthitis, and persistent postural perceptual dizziness. Now, I know this is a lot of big words, but just bear with me because in the upcoming slides, it'll make a bit more sense when I go into detail for each disorder. So this is everybody's favorite, or really not so favorite, BPPV. This is true vertigo. So usually when somebody has vertigo, I'm just going to move my taskbar over here. When somebody has true vertigo, they have spinning dizziness. This is usually associated with head movement or rolling over in bed. It can also be associated with somebody looking up at the light fixtures or when they bend down and they pick something up. And what's really happening in the inner ear is there's dislodged calcium crystals, and they should be in the base of the semicircular canals, but with vertigo, the crystals, they actually end up in the canals. So how do we diagnose this? We diagnose this with the Dix-Hallpike maneuver. This can be diagnosed by an ENT, an audiologist, or a physical therapist. And what we typically see is something called beating nystagmus. Now, nystagmus really just means eye jerking movements. So when the doctor performs this maneuver on you, they will look at your eyes as you are laying down in this position, and if your eyes are beating towards one side, that could indicate you have this true vertigo. And how do we treat this? Usually the physical therapist will treat this with something called an Eppley maneuver. It's a very simple maneuver. Sometimes it only takes one instance of the Eppley maneuver to fully get rid of the vertigo. And sometimes it takes quite a few times of the Eppley maneuver to treat it. So again, this is just the same picture we saw on the slides prior. I'm going to focus on right here. If you can see these pinkish purple, they almost look like candies on top of this blue rectangle here. These are the crystals that I'm talking about. So we want these crystals to be very finely packed together like we see in the picture. That is a normal inner ear, somebody without vertigo. If somebody has true vertigo, true BPPV, these crystals, they will get dislodged into these canals, and that will cause you the dizziness symptoms when you're rolling in bed, moving your head, bending over to pick something up. That's really what's going on, is that these crystals, they're getting dislodged into a spot where they're not supposed to be. So we do the Eppley maneuver to get the crystals back into the base here where they need to be. Now these crystals, they're made up of calcium. So if you believed that you have this true vertigo, it's important to have your calcium and also your vitamin D levels checked by either your primary doctor, can order that in blood work, or an ENT, because if you have a low or high calcium or vitamin D, that can really affect the crystals and have them get dislodged. Also, hydration plays a big part in this type of vertigo. If you are low hydrated, if you're not drinking enough water, then that can also make the crystals get dislodged as well. So moving on, this is another type of peripheral disorder in the inner ear. This, honestly, if I had to pick which one not to have, it would be Meniere's disease. Meniere's disease is, it's almost a death wish from the patients that I have seen in the past. It's a terrible, terrible disease to have. What happens is these patients, they get severe incapacitating episodes of dizziness. They get ringing in the ears, ear fullness, hearing loss that actually can be permanent, and they have extreme episodes of vomiting. And what's happening is there's an abnormal buildup of fluid in the semicircular canals and also in the base. So how do we diagnose this? Usually at an ENT office with a combination of an audiologist visit. How is this treated? So unfortunately with Meniere's, there's no end-all be-all cure. Usually the episodes are treated with steroids or like a meclizine to try to suppress the symptoms that you're having. How can we limit these episodes? Usually the patients, they try to limit salt in their diet, sugary foods, but unfortunately they do go to the ENT quite often throughout the year. Meniere's disease, again, it can lead to hearing loss. A lot of times it can be permanent hearing loss, and it can worsen over time with the more episodes that you have. This is another one we're going to touch base on. So vestibular neuritis, this is really just a virus to the inner ear, to that balance system. And usually it's very sudden. You get these symptoms, you wake up one morning, very, very sudden. It can be treated with steroids or with physical therapy, which in the audiology world we call vestibular rehab, meaning balance rehab. Again, it's caused by a virus or a bacteria in the inner ear. And a lot of times you don't really have like typical colds or virus symptoms like a runny nose or fever or a cough, sore throat. It's more you have symptoms in the ear, such as dizziness, hearing loss, off balance symptoms. Vestibular schwannoma. This is categorized with progressing hearing loss, ringing in the ears, dizziness, and balance disorders. I really like this picture a lot because it shows perfectly what a schwannoma is. So it's a tumor that you can see. This is the nerve, the eighth cranial nerve, my favorite nerve. The tumor is growing on the nerve, but it's pressing into the brain stem right here, which can cause all different types of hearing and balance symptoms. This is usually diagnosed with an MRI as well as a hearing test, sometimes a CAT scan, but usually an MRI. The good news is that usually this tumor is benign, but usually the bigger it gets, the more it does press on the brain, which could lead to further issues down the line. So a lot of the patients that have vestibular schwannoma, they will get surgery eventually to fully remove the tumor. Now, the risk with surgery is that because the doctor will be cutting out the whole tumor, you can ultimately lose hearing because of how close the tumor is to the inner ear and to that hearing organ. So that's the downfall with the schwannoma removal. Superior semicircular canal dehiscence. So what this is you get off balance symptoms. It's usually loud noise induced. So a patient that has this, they do not like loud noises because it will cause them to get dizzy. They also don't like flying or scuba diving. Pressure induced dizziness they will get if they have a drop in pressure, an increase in pressure. So what's going on in this type of disorder is there's actually an absence of the covering of one of the semicircular canals. So there's no bone essentially there. This is diagnosed usually with a CAT scan that reveals this hole in the canal. Usually with this type of disorder, the doctor will recommend lifestyle adjustments to avoid triggers such as loud noises or pressure adjustments like flying or scuba diving. Eventually surgery might be needed just because of how severe the symptoms might get. So this is just a picture right here. We see the semicircular canal. We're missing the bone, the bony structure up here. So that essentially has a hole in the canal, which can leak fluid into places where it's not supposed to be. Vestibular paroxysma. This is spontaneous. It's usually very, very short episodes, but they last throughout the day, like a minute at a time. And what's happening is it's more of a blood disorder issue. So the blood vessel is compressing on that eighth cranial nerve. So usually it's diagnosed with an MRI to visualize the compression. So how this is treated with medications or sometimes even surgery to separate the nerve from that compressing vessel. Cholesteatoma. So this is a cyst. It's a buildup of cells in somewhat in the middle ear, but more so in the bone, the mastoid bone, which is just the bone that surrounds your ear. So this is associated with ear drainage, ear pain, dizziness, and sometimes even hearing loss. This is a very destructive type of cyst, and it can really affect the middle ear space. It's diagnosed with a CAT scan. Usually, the doctor will suggest surgery if it continues to get large enough. Okay, labyrinthine fistula. So this is associated with spinning, feeling, hearing loss, ear fullness, and ringing in the ears, tinnitus. This is a hole in the bony structure surrounding the inner ear, specifically the labyrinth. So this usually is caused, this is secondary to a cholesteatoma. Again, it's diagnosed with a CAT scan. Usually the ENT will suggest surgery to remove the cholesteatoma and then afterwards repair the fistula or the hole with tissue grafts. Enlarged vestibular aqueduct syndrome. So this is hearing loss, dizziness related. What's going on is the vestibular aqueduct, which is essentially the base of those canals. It's abnormally large, it's swollen. This is actually a genetic mutation, and it's diagnosed with genetic testing, hearing tests, as well as possibly a CAT scan. And how we treat this is usually with hearing aids. Labyrinthitis. This is spinning dizziness, hearing loss associated. This is a viral or bacteria inflammation of the labyrinth. ENT will diagnose this in combination with an audiologist. And most patients, they actually heal within a few weeks. So sometimes physical therapy will be needed if the symptoms last longer, but usually this will clear up on its own, if not with the help of some medication. I promise we're almost done with the peripheral disorders here. I know there's a lot of them, but it's important to touch on each one. So this is persistent postural perceptual dizziness. This is more dealing with balance. So this person who has this will have chronic dizziness that just won't go away for months and months and months, sometimes even years. It's not really spinning dizziness, it's more just being dizzy, more like a swaying feeling, unsteadiness. And this usually it's exacerbated by upright posture. So when you're sitting up nice and straight, or if you're standing up and your spine is nice and aligned. And this can also be stimulated with complex visual stimuli, such as driving, roller coasters, if you're walking through a mall. So this is usually secondary to other vestibular or balance disorders, or even it could be secondary to panic attacks or a traumatic brain injury. This is diagnosed with an ENT and a physical therapist. Sometimes the audiologist will do testing like a VNG. This is most definitely treated with vestibular therapy, sometimes even psychiatric therapy, depending on how bad the patient's anxiety is about this, just because of how long this type of syndrome lasts. Okay, so we made it through the peripheral vestibular disorders. I'm going to bring everyone back here so I can see all your faces and make sure you're still with me. Okay, we all made it through that one. I know there was a lot, but there's a lot to touch on. And like I said earlier on in the presentation, when someone says they have vertigo, it's really not the appropriate term. Really, there's so many types of vertigo, and most often than not, it's a peripheral disorder. So I appreciate you hanging on through those disorders. We're going to switch now on the central vestibular disorders. So we're going to start with Maladie-Debarkman syndrome. So this, I know most of you have known somebody in your life who has had this. So Mal-D-Debarkman syndrome is a persistent feeling of rocking or swaying while you're stationary, and this usually happens after a cruise. So you're so excited, you go with your family on that cruise, you have a wonderful time, you've eaten multiple Thanksgiving dinners each night on the cruise, and you get off that boat and you just do not feel good. You feel like you're still on that cruise, you're moving, but you're not on the cruise. So this actually originates in the central nervous system. An ENT or a physical therapist can diagnose this. Usually it's treated with vestibular therapy with a physical therapist. Um, Sometimes it goes away on its own, but a lot of times for patients, it can last weeks and weeks after the cruise. So you might have to go see a physical therapist for some treatment to get you better grounded. Vestibular migraine. This is another one that I don't wish on anybody. So migraines, nobody wants them. They're just absolutely terrible. This can often be paired with spinning as well. And what's happening is there's disruptions in the brain's processing of the balance and spatial orientation. Usually, this is diagnosed with an ENT, psychiatrist. Most often than not, medications are involved to try to counteract the symptoms of the migraine, as well as lifestyle changes, which could include decreasing salt in the diet, more hydration, avoiding triggers that can trigger the migraine, such as light. Sometimes vestibular therapy is warranted. So this is a big word one. Cerebellar ataxia neuropathy vestibular areflexia syndrome, otherwise known as canvas syndrome. So what happens here is there's a loss of coordination and balance of nerve sensation. Usually this person has a chronic cough and difficulty speaking at times. That's the ataxia part. What happens is there's a mutation in a gene. This is another genetic condition. How this is diagnosed is through neurological exam as well as genetic testing. And usually this person does see a number of doctors to try to help counteract the disorder. So they will be seeing a PT, they'll see a speech therapist, cardiologist to manage the blood pressure, as well as their ENT. Okay, and these also are just another realm, so to speak, of the central disorders here. So we all know what a traumatic brain injury is. That's a TBI. Usually we see a lot of these in the NFL when the player has had too many hits, and it's actually very sad. I know a lot of my patients, they love the NFL, but each season we do see so many of the players get hit and then they're out on the field cold. Sometimes they're knocked out, sometimes even leading to seizures. It's very scary. So this is a central disorder. Multiple sclerosis, we all know what MS is. It's a very unfortunate disorder and disease that we see. It's degenerative, and then a stroke. So stroke can also cause some balance and dizziness symptoms as well. So this is the end of the presentation here, but I just want you and your family members, whoever has this dizziness or off balance disorder, keep in mind there's different holistic things that you can do at home. So hydration. This is the biggest thing that I can give you, biggest piece of advice. You should be drinking plenty of water throughout the day, especially if you're prone to dizziness and off balance. I see so many patients, even in my last practice, where we had a balance center in-house. A lot of the patients that came in, they were dizzy, off balance, and we would ask them, well, how much water do you drink a day? And they would say, oh, well, I don't really like water. I drink, about 5 cups of tea, or I drink Diet Coke, or I drink juices, or that's not water, so that's not hydration. We really need hydration to be mainly water based. So if it's not pure water, vitamin water is very good. If you don't like all the sugar in it, you can cut it with half water. But I like to give a rule of thumb that you should be drinking at least half of your body weight a day. So if you weigh 200 pounds, you should be getting close to 100 ounces of water a day. And I know that sounds like a lot, but it's really not. If you're up for 12 hours, as soon as you wake up in the morning, down a nice 8-ounce glass of water, have your breakfast, have another 8-ounce glass of water. It adds up over the course of the day. Now, I'm not saying to not have juices or sodas or your favorite drinks, but it's important that we really, really stay hydrated, because that will ultimately help your dizziness. Diet. So diet, there's a few things we can do to combat the dizziness. Evaluate the salt in your diet. So if you have a lot of foods that are like those frozen meals, like the Stouffer's lasagna, I mean, it does taste great. I agree with you there, but it's loaded with sodium. So if you're able to cook some of your meals from scratch, or I mean, it doesn't have to be fully from scratch, but when you cook, it's a lot healthier than when you get it at that's processed and frozen foods, or at McDonald's, or even Applebee's. All these places, they're loaded with salt. So keep the salt down. Same thing, alcohol. Alcohol is, there's so many patients that we saw at the ENT practice that were dizzy. They would come in and, we would say, well, do you drink alcohol? Oh, no, not really. I only have 2 martinis a night. Well, there you go. I mean, maybe you cut down the martini usage and you would feel a bit better. So alcohol is a big one too. Medications, if you're on any medications, you should be aware of all of the side effects. So if you don't know the side effects of a particular medication, you can talk to that doctor who prescribed it and ask them, does this medication have any side effects in relation to dizziness or off balance symptoms? I mentioned earlier, you want your vitamin D and calcium levels checked at least on a yearly basis to make sure that they are up to par. Especially for those of you who have the BPPV, the true vertigo, because if you have a high or low level of vitamin D or calcium, that can very much impact your vertigo. Blood pressure. Blood pressure is a huge one too. So if you are prone to low or high blood pressure, that can definitely impact dizziness and balance. So we really want to make sure you're taking your blood pressure medications if you are on them, or if you do feel like your blood pressure drops suddenly throughout the day or increases, with stress from your kids, or another stressor in life. We definitely want to monitor that. Family history. Do you have family history of dizziness or balance disorders? Because again, we had spoken about a lot of those genetic conditions in the slides prior. Anxiety. Now, how can you not get anxious when you are prone to dizziness and balance disorders? I mean, it's scary. A lot of these disorders we have no control over. They come at the worst times, even right before a friend's wedding, and you're like, oh, the worst time for me to get my vertigo. But anxiety does play a big role. So sometimes when we work ourselves up, with associations, like if we have a wedding coming up and we're like, um, we're so excited for the wedding, but we're kind of stressed out, that can also cause us to have, some of these dizziness and balance symptoms. So we want to keep our anxiety under control as best as we can. And I know it's hard with this type of life that we're living now in 2025, but there's plenty of doctors you can talk to about the anxiety, or even groups, or even, holistic things you can do at home to try to help calm our nerves down a bit. Chemotherapy can also cause some dizziness and off balance symptoms. you kind of have to obviously pick your poison. We definitely want you to go through the chemotherapy and radiation to treat your tumor, but just know that that can be a side effect, the dizziness for that type of treatment.